I am here with Ken Langa, one of the co-directors of the Health and Retirement Study, and we're going to ask some questions of him today. Can you tell us, Ken, a little bit about the Health and Retirement Study and what it does?
Yes, so the Health and Retirement Study.
I'm going to swing with him.
The Health and Retirement Study has been collecting data on adults in the United States since the early 1990s. And one thing Jessica and I were chatting about before is that the big grant for the Health and Retirement Study doesn't actually fund any research. We don't do any research. What we do is just collect lots and lots of data, hopefully the best possible data for researchers from all different disciplines to use our longitudinal data to try to understand what's happening to adults in the United States and how they might age in a healthy way. What else? Yes, we collect lots of different kinds of data. We do a survey, either by telephone or in people's homes or on the web. We link to administrative data, things like Medicare data and Social Security data and National Death Index data. Jessica has been leading the efforts to collect biological data for the last almost 20 years now, right? 2006 we started doing that. So we now collect blood and saliva. Those are the only fluids we collect. Yes, just blood and saliva so far. And there has been discussion of others, but none yet. And yeah, that obviously has opened up lots of additional types of research trying to understand the biology of aging and how the environment affects the biology of aging and things like that.
Great.
How's that?
That's great. Right. So what is something, your own research, that you do that you wish people knew more about?
So let's see. So since I've started working on the HRS 29 years ago in 1997, I had a meeting in the office right over there with Regula Herzog, who's a psychologist who was leading the first sub-study of dementia and Alzheimer's disease in the HRS. So I've been mainly working, that's been a focus of my research ever since that meeting with Regula there almost 30 years ago. And let's see, something I'd like people to know about that. One question, important question, I think, of that the HRS and the dementia data we collect has allowed us to study is that the risk of dementia in the United States has actually declined over the last 25 years or so, meaning an 80-year-old 20 years ago was more likely to have dementia than an 80-year-old today. There's more people with dementia in the United States than back then because the number of older people has increased significantly. So that decline in dementia risk has been found in other high-income countries around the world. We think it's a real result, and it's probably related to things like increasing levels of education in the United States. People with after World War II and the GI Bill facilitated many more people going on to school and for longer periods of time, and that's good for the brain, we think, to be educated. And it also kind of points to the idea that there are things you can do to intervene and decrease your risk for dementia because there were no new big medication breakthroughs or other things that happened during that 25-year period. So that's sort of an optimistic finding, both again here in the United States and other places around the world.
So I'm going to ask you a question not on my list, since
Okay.
you said in the United States. HRS has been propagated in many places. Could you name some of the interesting places of which HRS has sister studies?
Yeah, so that, again, one of the incredibly fun and fascinating parts of working on the HRS for the last 29 years is that sort of pioneered and facilitated by the early HRS team, folks like Bob Willis and David Weir and folks at NIA. The HRS network of studies is now more than 40 countries around the world. The first few were in Mexico and England and the European Union. More recently, there's been more studies in Africa, places like Kenya. South Africa has been collecting similar data for a while. Malawi and Ghana and Nigeria and other countries in Africa have started up similar studies. So there's, again, more than 40 countries now that are collecting similar data. That's been trying to collect data in ways that allow you to do valid comparisons across countries has been a focus of a lot of the sort of methodologic work that people have been doing. Straightforward things like different languages, and are you translating surveys in the right way, or do children in other countries describe their parents' function differently than children in our country? So specifically around dementia, we ask a family member, how's this person doing? And we see probably places, for instance, in Asia where it may not be culturally appropriate to say my dad's not doing so well, and trying to understand those kinds of measurement differences are some of the things we're doing.
Yeah, great. What is something you enjoy doing outside of work when you're not talking about HRS?
I talk about HRS even outside of work. That's one thing. Well, again, related to the HRS, I've been lucky enough to be able to travel in other places. My wife and I like to travel. There's a pilot study in Guatemala, HRS pilot study in Guatemala that I went and worked with some of the interviewers there last week, and my wife joined me, and we got to hike. We like to hiked around incredibly beautiful places in Guatemala. I have kids who live on each coast, and we like to go visit them, probably more than they like to have us visit them. But yeah, in Washington State and Massachusetts, so that's another thing I like to do.
Great. Thank you very much.
All right.